Thanks for coming, everybody. It's great that you could give your time and come to see us. It's a really important project that we do here. This is obviously your focus group. It's really important that we keep this going. Thanks very much again, and we'll get started.
From our point of view, I think it's as important that as many patients as possible are invited into research projects. It's the only way that we can find out which drugs should be used for which patients, and also how to evaluate new treatments which will benefit many patients who've hitherto perhaps been untreatable or have been treated with the wrong sorts of drugs.
I think over the last few years we've seen real increases in the number of patients that have taken part in research in the Trust. It's something that obviously we're really grateful to patients for, because at the end of the day any participation in research may not benefit them initially, but it'll benefit patients in the future.
My name's John, and I got diagnosed with COPD over 10 years ago, and I've been coming to the clinic on and off since. Well, at our meetings, research meetings, the nurses ask you if you meet the criteria, are you willing to volunteer to take part in these research programs, which I'm very keen to do so, in case on one of these studies that we do, hopefully better medication could be found.
The respiratory research we're involved in here in Lung Health are for patients with any respiratory condition: asthma, chronic obstructive pulmonary disease, bronchiectasis, emphysema. They can be as involved as they want to be. It's quite a large commitment for some studies, but for some studies they might just need to come in for a blood test. We might send a questionnaire out to them at home. They might come to try new treatments for chronic obstructive pulmonary disease. They can withdraw the consent at any time. Obviously, we would encourage people to stay in the study if they wanted to, but it is very worthwhile and I would encourage it.
Personally, with the respiratory research, we have a focus group that we run 4 times a year, and we invite all of our patients that have had anything to do with research or shown any interest. We invite them to come along, discuss what they've been involved in, what they'd like to be involved in and how they'd like to be involved, and basically support them and get them to support each other. We think it's really a good idea to invite people in to share with us what they want to know. And then we've got the new study, which is the FLAME study for the COPD patients, which John started on now, and John's going to come on.
What does that involve?
It involves a new inhaler, and it's just like like the tiotropium one.
Right.
One of them.
Smaller version.
Yeah, it's just a smaller version, and it's that against a placebo, so you don't know which one you're on.
There's a lot of regulation around research, and patients should be really reassured that if they're approached to take part in research in this Trust or anywhere, that they'll be fully informed about the research, that it will have been approved by a research ethics committee, and that it'll also have been approved by the R&D department here in the hospital. And we make sure that all the things such as the patient's safety has been addressed, that patient confidentiality has been addressed as well, so they can be reassured that if they're being approached about that piece of research, that people have looked at it and have decided it's a safe piece of research to take part in. They'll get a patient information sheet that'll have full and comprehensive information about that study, and it'll explain really clearly the risks and benefits of taking part in that research.
You can find out about research from basically anywhere: GP surgeries, your nurses. There's research nurses within the hospital. There's many different departments. There's also research and development in this hospital which can be contacted, and they can tell you about any research that's going on. There's also a website that can be accessed that the Research and Development Department can give you, and you can actually look on to see if there is any research that's actually involved with any condition that you might know about or have family that have. You don't necessarily have to be a patient in hospital to be involved in research. You can be anybody with any condition. It doesn't necessarily mean that you have to stay in hospital either. There are patients that come and go that are involved in our research that only come in for small visits, maybe it's a couple of weeks, and then that's it.
Every part of research is really important, and we would encourage any patient to give us a ring and get involved in research.
Obviously, we would like more people to be involved in our research, and any research really. The only way forward with any treatments is to have the research there, and we really appreciate everything that everybody's done and how they've been involved, but we invite everybody to come along.
From my point of view, it means that we can evaluate new treatments and make sure we know how best to use them. From the patient's point of view, it means that they know they'll be getting the best treatment. And also departments that are involved in research generally up their game, so that you'll find that if your department is doing research, it'll be at the cutting edge of technology.
Well, I was asked if I would like to join the group, and obviously I was interested, because obviously if there's anything that can help my condition, I want to be there to do it.
Anybody who's willing to take part, the nurses make it at ease, so please volunteer. You've nothing to worry about.